Hey, as people are trickle in, I guess we can start with introducing our amazing speaker today, Dr. Robin Michaels. And again, this session is going to be on how do you making the most of your interview. As you might know, that is one of the most crucial or one of the most crucial steps in the entire like application process of honestly like not only just like pre-house admissions, but also like all admissions. And a quick bio for Dr. Robin Michaels is that Dr. Michaels received her Bachelor of Arts in Biology from the University of Colorado Boulder, then went on to do her doctoral work in anatomy and neurobiology at the University of Minnesota Medical School in the Twin Cities, and then postdoctoral work studies in the molecular biophysics at Washington University of St. Louis. Prior to 2013, she was Associate Professor of Cellular and Developmental Biology. Um, and Assistant Dean of Preclinical Curriculum at the University of Colorado Anschutz Medical Campus. And she currently serves at the Associate Dean of Student Life and Academic Affairs at the University of Minnesota Medical School Duluth campus, where she oversees the offices of Student Affairs and Admissions. Please welcome Dr. Michaels. You guys can use the reactions to indicate the. But yeah, Dr. Michaels, take it away.
Thank you so much. Well, that was a wonderful introduction. Thank you very much for that, Michael. And I'm thrilled to be here today to talk to you about making the most of an interview. As Michael said, I've been mostly associated with medical schools, so I'm going to be focusing on mostly, medical school type things, but this is going to be relevant to any of the professional programs that you're applying to. So PA, dental, whatever, nursing. So I'm really glad to be here today to talk to you about this. Okay, so next slide, please. I want to just start out by saying that if you have been offered an interview at an institution, you should feel really good about that. So I want you, when that comes into you, to congratulate yourself because it means that the program has looked at your packet and it is they are looking at everything that's in it, the good, the bad, and the ugly, whatever you're concerned about, but they believe that you are a viable candidate for their program. So they want to hear more about you. So you should really, embrace that and congratulate yourself on that. Next slide. And most of our professional schools require an interview of some sort as a part of their admissions process. Different types of interviews we'll talk about, but they do it for two major reasons. The first one is that they want to know more about you. They want to make sure that you're a good fit for their program. They want to know what your interests are and whether you're a good fit for the program from their perspective. But they also want to know that you have explored their program and that you have an understanding of what the school has to offer you and that it's a good fit for you. And that's in the best interest of the program too. I'll just say that. Next slide. So the schools, what are they really looking for? Your interest in whatever profession you're interested in. So I'm going to say interest in medicine. They're interested in your journey towards medicine as a career. What did you do to get interested in medicine? And what have you been doing between the time that there was an interest sparked and you're now applying to their program? What have you been doing? What's your motivation for a career in medicine? And by motivation, I mean, what's going to keep you going when things get tough? Not just getting into medical school, but all the things that go along behind that. And your understanding of your career interest and what you might bring to the institution. Next slide. So they're going to look at your interpersonal skills. They're going to look at your maturity, and you might say, how are they going to measure maturity? And really, it just has to do with your life experiences and your readiness for a program. How do you relate to other people? You're going into professions in the health professions that involve people. You have end users, and those are your patients. And so it's very important that you be able to relate to those folks. How do you handle stress? How do you formulate and defend answers to questions? And they may inquire about contents in your application. And I want to stop here and just mention to you that if you put something in your application in the case of medical school, it's an AMCAS application. Maybe you put something in your personal statement that's personal. Make sure that whatever you've included in there, you're comfortable talking about, because you've sort of opened the door to that when you've put it in a packet, and you often get questions about that. So be aware of it. If you're not comfortable talking about something, don't put it in your application. Next slide. So I won't pretend to even begin to know what you're looking for. That's your own personal path to your professional program. But students have told me that these are the major things that they're really looking at when they're looking at programs. They want to gain information about the school. And I would highly recommend that you go to the website of the school before you even apply to that school to make sure that it's a good fit for you. They want to understand what the school has to offer. What's the learning environment like? Is a lot of it asynchronous? Are they small classrooms? Are they small group sessions? Is it a big auditorium? You know, what is the learning environment like? What are the research opportunities? For those of you interested in subspecialties or things like orthopedic surgery in medicine, that's a very competitive area. Are there research opportunities to help get you there? I will just say that much of what we do now in our professional programs has moved to a pass-fail system. So it becomes more important for you to think about other ways that you can prove yourself and really stick out in your application. What are the community service opportunities? You obviously are wonderful people who are interested in helping other people. That's the humanistic side of you. And so you're going to want to be doing things that help feed that in you while you're doing all of your book learning and your, all of your coursework. So what are the community service opportunities? And what are the available scholarships? Because this is going to be hundreds of thousands of dollars. I mean, you're talking about big money when you're talking about these, the training programs. And does the school seem like a good fit? And by this, this is a very simplistic statement, the way that it's put here, but it actually speaks to the gestalt of when you come out of that interview, how are you feeling? Do you feel like this is a place I could spend 4 years or however many years your program is? Is it a place where I have real concerns? Listen to that voice and make sure that it's a good fit for you. Next slide. Okay, so there are different types of interviews. I've kept this very simple. Prior to COVID, much of our interviews were in person. During COVID and even after COVID, many of our interviews are now virtual. And the reason why we've kept things virtual, or at least a hybrid version of virtual, is because we realized that many people were applying to our program that ordinarily wouldn't have been able to afford to come up for an interview. And because the interviews are done virtually, they can apply to more programs. So many of our programs, including the one that I'm involved in Minnesota, have stayed virtual in our interview process. Okay, so different types of interviews. There's the traditional one-on-one type interview where you have you and usually one other person that's going to be asking you questions. Usually you have 2 people that will interview you for 30 minutes to an hour during that interview slot that you have. There's an interview panel in some schools where you'll have 2 or 3 people that come in as a group and you'll appear before them and answer their questions. And oftentimes they have standardized questions that they're going to ask you. There's the multiple mini interview where you have multiple stations, maybe 8 or 9 stations that you will be going one after the other to, and you'll be asked to do various things or ask questions or discuss something. I'm going to come back to the MMI because this has become a really popular interview strategy that many schools are using. And then there are video interviews. Those are one-way interviews. And I've seen these used less in admissions for professional schools and more in interviews for residency programs or for jobs. Basically, you have a video platform of some sort. You're given a series of questions that you need to address in a time period, and then you submit your video to the program. So those are the main kinds of interviews that we have. Interviewers, you might think of as mostly being faculty, but they're a mixture of people. We have faculty, we have students, and I have to tell you, the students are some of our best interviewers because they not only look at your credentials, but they're looking at you as a potential colleague and classmate. And I think that's a really important perspective that they bring to the committee. We have administrators that will come on board and do some of the interviews. And we also have community members. The regional campus that I'm affiliated with has as its mission rural and tribal community service. So we are preparing primary care doctors for rural and tribal communities. So it's very important to us whenever possible to include our communities in those selection processes, because those are the communities that will be served. Some of the programs, as far as opened or closed applications are file applications are concerned, traditionally, there used to be files that were open, which means that an interviewer saw everything about your application, including your grades. In medical school, it's an MCAT score, which is a pre-med exam that you take. They would see all of that prior to the interview. And most programs, not all, but most of them have moved to what's called a closed applicant file system, where they're blinded to certain things like GPA and MCAT score. And they don't see that until the end that they've already scored you on your interview. And most of the time you have a screening process prior to anyone being interviewed that has already determined that your GPA, your MCATs, your various scores are suitable for the program already. So most committee members actually like that. And there are usually standardized questions that are used in programs. They might have standardized patients. They might have actors. They have a list of questions to make sure that there's similar questions asked of all applicants. But usually an interviewer also has an opportunity to ask some of their own questions. And this is where people might tap into your personal statement and ask you some questions about you as a person. Next slide. So that's the kind of the layout and structure of the interview. So how do you prepare for this, especially if you're going to apply to multiple programs and you're going to have different kinds of interview? I would start, as I said before, with checking the websites and the admissions websites for schools that you're going to, because that will prepare you for the types of interviews that you'll be doing. But they kind of are going to be going after the same thing. They want to know more about you. So I would begin by doing something that sounds really basic and crazy because you were the ones who wrote the application, but review what's in it. And just because sometimes you get so far away from that you forget the context of what somebody might be asking you about during the interview. So review it. Be aware of the strengths and weaknesses of your application, and try to anticipate some of the questions that an interviewer might have. And then be prepared to answer the probable questions of any interview for a professional program, which would be, why medicine in the case of medical school? What are your career goals? Are you interested in primary care? Are you interested in serving a community that is the mission of a program? It's really important that that's one of the reasons why you want to check and see what the program is doing and what its mission is, to make sure that you're a good fit for it. What was your pathway to deciding that you wanted to be a dentist, a doctor, a nurse, a PA? And how have you informed yourself about a career in that profession? And how have you demonstrated your leadership skills? Most of the time, if you're a physician, you're going to be leading a team, but you are going to be a part of a team that involves a group of very specialized people. How have you demonstrated compassion and concern for others? This is the humanistic side of caring for other people. And I think this is a really important thing that we look at when we're interviewing. What is the driver that keeps you going when things get tough? And it usually, most of our students are very grounded in caring for others and service to others. And this is a question, the next question is one that I always ask, and it's actually very important because we have well-being programs now. What do you do for fun and relaxation? And I'm always concerned occasionally, very rarely, but occasionally, if I ask somebody what they like to do for fun, they might say, well, I don't really have time for that. And that's a problem. Make sure that you do have time for yourself. You won't be a good dentist, doctor, nurse, in caring for others if you don't take care of yourself. So your well-being is critically important. And we also want to know how well you handle difficult situations. What is your resilience? And we've seen people who have come through really difficult things, and they make some of the best pre-health or health profession people because they know themselves and they have had adversity before. And so those are actually positives that we look at in the interview. Next slide, please. We also want to know something. You should also be aware of current social issues. And I would say that in the last couple of years, we've had some really critically important social issues that have bubbled up in this country. So maybe questions about health disparities, access to health care, women's health care, single payer insurance, maybe immigration. What can and do we do for people? And those are things that are really important. I think they tell us that you are paying attention to what's happening in the world and that you're prepared to deal with that as a leader in health professions. Think about questions to ask about the medical school. I mentioned the thousands of dollars that you pay to go to professional school. You're investing in that. So you want to make sure that the school is a good fit for you. Make sure that you come with questions. I am always impressed when a person comes in and I know they've read our website and I know they've thought about the missions of our program. And so make sure that you have some questions to give to us. Practice your interview with other people. You can sometimes get a practice interview with somebody from your admissions program at your school. They are, of course, they have to recuse themselves and not interview you if you're applying to a program that they're a part of. But see if you can get somebody to just practice an interview with you. Don't have your mom do it. Don't have your best friend do it. You want somebody who is a little more neutral, who can ask you questions and sort of put you in the seat of what it's like to be asked a question and have to answer that on the spot. Be aware of body language and nonverbal communication. Don't be looking out the window and acting like you're sort of not interested. That doesn't come across well in an interview. Also, if you act like you're concerned or you just want to be aware of how you respond to questions. Select and wear the outfit you intend to wear for the interviews. Many of you don't dress in day-to-day life like you do when you're going to be interviewed. And this is true all the way through professional school and all the way through applying for jobs out in the real world. It's helpful to put on a suit and tie or just put on something that you typically don't wear. And it actually helps kind of make you in the moment for an interview when you do that. Work to develop an appropriate professional demeanor, meaning, how do you come across, sit up straight, engage with a person that's asking you questions. Please turn off your cell phone. I think every single person on this call, myself included, has had their cell phone go off inappropriately before, and you just don't want to do that. Also, don't be checking your cell phone while staff are talking to you. I want you to know that staff are critically important. They might not be your interviewer, but they do weigh in on behavior of people that come in for an interview. And by coming in, I mean coming in for a second look day, maybe taking a tour, and of course, doing things online on a video screen as well. And remember that you're on all the time when you're interviewing, so just be aware of that. Next slide, please. So during the interview, try to relax and control your nervousness and anxiety. There might be some of you out there that don't get anxious. I'm not one of them. It does make me nervous if I have to apply for a job. I'm always trying to anticipate what the questions are going to be. What I would suggest is that you just take deep breaths, because we know that physiologically that helps to control anxiety and nervousness in the body. Deep breath, exhale, just have a moment to yourself before you go in. Trust me, when I interview people, I expect them to be nervous. This is a high stakes interview for them. And if they care enough about it and getting into a program, which I know you all do, you're going to be nervous. So that's perfectly normal, but you just want to have some control over that. Be attentive and be interested in that interview. Listen to the questions asked and give a thoughtful response. And if you don't understand the question, do ask for clarification. Respond appropriately, not too brief, but also don't ramble. So I can tell you that it's really hard to interview somebody that gives yes or no answers, because you all of a sudden have a whole gap of time because they haven't elaborated. But it's also really hard when you have somebody who has scripted their answers and they just ramble on and they are trying to get their spiel in. And they're not really answering your questions. That actually does not come across as well. So listen to the question, be thoughtful about answering it, and be done with it when you're done with your answer. Emphasize your strengths. There's nothing wrong with that. That's not being boastful, but be aware of areas of concern or areas where you might need improvement. Don't exaggerate. Be honest about who you are. And I said, you be you. I want you to be authentic in an interview. I really want to know who you are. And I want you, when you walk away, to really have a good feeling that I was myself in there. I told people how I feel. And I really want to go to that program. I want you to walk away saying that. If you're trying to tell the schools what you think they want to hear, in our program that has a rural focus, has a primary care focus, if what you really want to do is a subspecialty in medicine, if you tell us that you really want to do primary care, a lot of the activities revolve around that. And you'd be stuck in doing something that maybe you don't want to do. So be you, be honest about what your interests are, and we do what we can to try and get you into the best part of the program. And ask questions that you've prepared or that occur to you during the interview. I've had people that jotted down notes during the interview just so that they remembered what to ask. Next slide. After the interview, it's traditional, in addition to thanking the interviewer, many of you will decide to send a thank you note. This is typically not done by email or by text. It's done by sending an actual physical note. And the way to do that is to send it to a person in care of the admissions office of the school where you interviewed, and we make sure that they get that, the individual gets that note. The second thing I'm going to say here about taking advantage of an opportunity to tour the school, but also to talk to the students, I think is critically important. I might stand there and tell you as a faculty member and as a dean, this is a great school, this is a great program, but the students are the end users. They're the ones that can tell you, how is it really? How is it to be a part of this school, to be a part of the curriculum, to be a part of the activities? What is it really like to live in this area? What kind of community do we have with our classmates? All of those things are critically important. So talk to students if you have any opportunity to do that. We even had meetings with student buddies during COVID on Zoom. And it's not the same as sitting down and having lunch with a student, but it definitely gave our applicants an opportunity to ask questions. Do that. Afterwards, reflect on your interview and ask yourself honestly what went well and what you could have done differently. Don't worry about any one answer and I should have said this or that. You don't have to do that. But try to be reflective because you'll have multiple interviews, hopefully, when you're applying for a program. Every time you do it, you will get better and better. And I will say that if you feel that there was something about an interview that was inappropriate or troubling or concerning, that you should contact the admissions office and see if you can get a different interview. And that's very easily done by Zoom. It was harder to do when we had in-person interviews and you came to town and then you got on a plane or got in a car and left. But with Zoom, we're able to do that. If you get asked something inappropriate during an interview, my advice to you is to keep your cool. It's perfectly acceptable to say, I'm not comfortable answering that question. You don't have to get into a sparring match with your interviewer. There's no reason to do that, but it is okay to say, I'm not comfortable answering that question and then reporting it afterwards. Next slide. Okay, so I said we'd come back to the multiple mini interviews. I want to give you a little more detail on this in case you have never done these before. But basically, they are a little different than your typical interview in that they provide insight into the applicant that's often not available in the application. It's a way to assess social cognitive competencies, your ethical decisions you would make, how effectively you work on a team, how well you communicate, and how well you problem solve are some of the things that they're looking at. And these are important for all schools, but some schools have very specific stations that they use and questions that they ask. Next slide. So the example of the MMI mechanics is that you have a series of, as I said before, maybe 8 or 9 different stations, and you are assigned to a station when you start, and you'll go in a clockwise fashion and go from station to station. There is usually a scenario that's posted on the door outside of the room that you will be entering to answer a question or to do some activity. You prepare, you're given about 1 to 3 minutes to prepare and provide a response. Then you go into the room and you discuss the topic with an evaluator. And you are certainly welcome to clarify if the question, if you need clarification, you can ask for clarification. You want to stay very focused in your answers because it's a quick turnaround. And you can ask your evaluator if they have any follow-up questions. Each station lasts about 5 or 8 minutes. It's sometimes, as I mentioned before, it's dependent on the programs. They might do their own unique thing. But just recognize that there's no right or wrong answers when you're talking about certain gray zone topics that are the cognitive, social cognitive things. There often are not right or wrong answers. And you usually are given several minutes between stations to write comment or for the evaluator to write comments and for you to move to the next station. Next slide. So I've put up here some of the scenarios that are encountered by applicants. On the left is the station type, and then in the middle is the interaction, who's going to be interacting within the room. And then on the right-hand side is the role of the assessor or the person that's in there evaluating you. So you might have a discussion type scenario where you have an assessor and an applicant, that's you, and you'll be discussing a topic. Maybe it's about a current topic, maybe it's about healthcare or something related to what was posted on the door. And the role of the assessor is to participate with you, but also to rate you. There are collaboration encounters where you have two applicants sometimes that are collaborating on something. Sometimes it's a real fun exercise, but you have to work together. And you have, as the assessor is the observer and rater. You have acting. Sometimes an applicant will have an actor or a standardized patient that they interact with. Maybe that person creates a difficult and confrontational situation, and they're going to, the assessor is going to be observing how you handle that. And it might be a debate where you're asked to take one side, the other applicant, another side, and the observer is looking at how well you handle that situation. So these are the different types of scenarios. Next slide, please. And how do you prepare for them? Well, I would say you prepare for them the same way that your student doctor sites and all the other Google sites help prepare you for everything else. There's a lot of information out there now because MMIs are used in a lot of different programs. So what I would do, though, in preparing is to think about some of the things that you see, the overlapping topics that you tend to see on these websites. Have some cornerstone experiences, maybe an ethical dilemma that you've had, and be able to talk about that and discuss it with your assessor. Understand how you handle conflict and conflict mediation techniques and what your style is. Read through some sample questions, think about them, practice how you would answer them, and think about how you work on teams. A lot of us, myself included, came into professional school sort of solitary, not always working on teams, kind of doing our own thing. But medicine, dentistry, PTPA, all of your health programs are now team programs. You don't have the resources to go it alone, and it's not safe to go it alone. So we have to learn how to work on teams. Next slide, please. Okay, so I've given you a couple of example scenarios on here. The first one is consider a mistake you made in the past that had a significant impact on another person. How did you handle the situation, and what would you do differently now, and why? So maybe you thought about this ahead of time, and there's something that you did to somebody, and you have thought about ways that you would do that differently. This is evaluating conflict resolution, self-awareness, communication skills, responsibility, that sort of thing. The second scenario is a little bit longer one, but due to the shortage of physicians in many rural communities, it's been suggested that medical programs give preference to students who are willing to commit to a 2 or 3 year tenure in an underserved area upon graduation. Consider the broad implications of this policy for health and healthcare costs. For example, do you think the approach would be effective? At what expense? And discuss this issue with the interviewer. So this is looking at communication skills and general problem solving. Okay, so that kind of gives you an idea of the kind of scenarios you might have. And last but not least, next slide. I want you to have fun. And I know you're nervous, but I hope along the way you meet people, you look at programs, you gain confidence, and you gain interviewing skills along the way. And we want you to enjoy yourself as you're going through this. And you'll have a lot of support and people there that can answer your questions and help you along the way. And with that, I'll open it up for questions. Thank you very much.
Thank you so much, Dr. Michaels, for the amazing and honestly like comprehensive presentation. Let's give a round of applause using the emoji reaction since we have that function ready. Yeah, and we also see a whole bunch of questions coming in as well. If you have a question that you want to post right now, feel free to still use the Q&A function to like ask a question and make sure to upload the question you want to be answered the most for our attendees. And I guess the first question from our attendees is going to be like, it's going to kind of a typical one. What is a good way to answer the why medicine question without sounding like cheesy or just another applicant? In other words, just like what type of answer can help you stand out?
So it's a great question. And I think it's unlikely that you're ever going to be asked directly, why do you want to be a doctor? Most of the questions are roundabout. So they are going to try to figure out, first of all, what are the traits of an excellent physician? A caring, compassionate, intelligent individual. So they're going to try and see if you have those qualities and traits. Okay, so that's kind of what this school is looking at in you. Um, I would be honest, what got you interested in medicine? I had one person who his parents were both physicians. They were friends of mine. And he said, I can't say on there that I want to be a doctor because my parents were doctors. But I said, well, why do you want to go into medicine? And he said, I watch my parents and they're amazing people. Um, I think that's an honest answer. So it might be cheesy. Just make sure it's really you. If that's what drives you to medicine, maybe it's an illness, maybe it's someone who's been ill, maybe you're just a science geek that loves people and wants to do that. And so, just be honest in your answer and authentic in your answers is what I would say. Don't worry about it too much.
It's great. Um, I guess the next question, we'll just dive in as we have a lot of questions actually.
Okay.
Um, what resources or strategies would you recommend for staying updated on current medical issues and ethics? Since you mentioned that, like, it's pretty much good to like stay on top of that.
Sure. Anything, any news, any legitimate news source. I'm just going to put that out there.
So
Uh,
right.
and I think one thing that is a really useful resource for people that are interested in medicine, for example, the Association of American Medical Colleges, the AAMC, has a lot of resources, including, they have the Careers in Medicine site that has information about preparing for medical school, preparing for interviews, all these things, but they also cover their AAMC news covers a lot of current events, and they go into race-based medicine. They go into really difficult topics that are really a part of our world right now. They've always been a part of our world, but they are things that we're looking at now in our programs, in our schools, and our institutions. So find sources like that that are known, legitimate sources that know something about patient care. AAMC is good for all of you. PA, dentistry, anything. You could go to AAMC and still get information on that. So that would be one of the major sources I would suggest.
Gotcha. Yeah. I mean, I guess like it's really about like just like latent learning from like kind of a daily life perspective and just make sure that you're also like hearing from the credible sources, I guess.
That's right. That's right.
Yeah. So the next question is that what is the questions? This is really relevant, I feel like. What are the questions that we could consider ourselves to see if a school and environment is a good fit for the student? Like, i.e., like, I guess what aspects of the school or the program should a student look into?
I would start with the website. And there's usually in the news on a website, what's going on a campus. I was just at our graduation and we had protesters on our campus that were pro-Israeli and we had pro-Palestinian. This is true of many of our campuses now, all peaceful, all legitimate, and all, welcome where they were. So I like the idea of, is it a place where if you have something to say, you feel comfortable saying it? If you have something that is not working for you, do you feel like you could get the help you need? Um, can I talk to people about mental health issues if I am concerned about that? Do I feel like I would be afraid to say that for fear that it would be held against me? I would never want to go to a school like that. I would never want to invest my money in training in a place like that, especially over a period of years. I mean, you're talking, for some of our programs. So I'm I think you want to be a little bit selfish and not in a bad way, but really ask yourself, what are my values? What are my priorities? And is this school representative of what I believe in and how I want to move? And right now, for some of our campuses, the answer is it doesn't align with some of the students. And so I think it's really important for you to ask those questions and see whether or not, if it isn't aligned with what you're thinking, what are they doing about it? Nothing, everything? Are they meeting with you? Are they talking to you? I think these are all really important because if you're going into the health professions, you care about advocating for patients. Whether you're doing teeth, whether you're, a PA or a cardiovascular surgeon, doesn't matter. You care about your patients and you need to be able to advocate. What does advocacy look like on your campus? How do people look at that? So those are the kinds of things I would look at. That's my own personal preference, but I did my undergraduate in Boulder, Colorado, so we were always stirring up the pot there. So that's my own bias.
I think that's an amazing answer, honestly. Like, I think it's something that definitely people neglect or overlook from time to time. For example,
Yeah,
like, I think most of us can echo that the period, is really Palestinian, is almost like dividing most
sure.
universities in the US. But at the end of the day, is really like the school's community vibes, how it's supporting your different voices and advocacies really matters.
That's correct. More so than even right or who's right or wrong. You should have different opinions. This is what colleges have always done so well. Is now I grew up during the Vietnam era, so we were protesting the war always. I mean, that was our big thing in the 60s. But you will have a lot of things that you'll feel strongly about. And I think that's the place that college campuses are where you do that. Um,
Definitely.
so I
Definitely.
think we got sidetracked a little bit there. I kind of took you on a tangent, but I feel strongly about that. Whether you're paying for a professional program or you're an undergraduate looking at schools, I think those are all things that you really want to look at and how that resonates with you and your beliefs.
I think that's totally fair. Yeah. And I guess the next question is really interesting as well. Personally, really curious about this. Is like, how would you answer the why not questions? For example, in a medical school interview, people might ask directly or imply that like, why do you not choose a career in PA or nursing? This person is asking in the context like how do you answer without sounding like condescending or like better than other careers?
Well, first of all, that's a not fair question to ask a person because I think it's a condescending question, to be honest with you. It's inappropriate. Has it been asked before? Absolutely. And I would answer that as professionally as I could, but I would also report it. So that's one of the questions that I would say deserves an answer like, I don't feel comfortable answering that question. I don't know that that's an appropriate question for me. And leave it at that. Don't encounter, don't, have an interaction that totally destroys your interview. However, I would ask for another interview. I don't, if a person is looking at me thinking that I don't belong in medical school because I'm a woman, or because whatever, because of I'm BIPOC or whatever it is about me, I would say that you want to pick a different program or a different interviewer for that. And I also would talk to the admissions office about whether that's a chronic problem. That tells me something about the program too.
Yeah, that's so
I know
fair.
that's kind of heavy hitting, but you're investing a lot in these programs and you want to make sure that it is a right fit for you.
Exactly, exactly. And it looks like I guess Lexi really wished that she have heard that before the application season. But yeah, that's really fair. I think that's a point that honestly like we usually misses, and I think that's a question that most pre-meds are most scared about. And I would like to appreciate that answer from you. I think it's totally legit that like
Yep.
we should think about it more critically, I guess.
Yes. And you should be, a person should be apologizing for asking a question like that, by the way. That's the kind of thing that might have been asked when I was in school. It's not something that should be asked anymore. We should be very comfortable with anything with sexual preference, anything. You should be, there's appropriate questions. If you want to talk about those things, you can certainly put those in your personal statement and bring those to the table. But there are things that are private, and you don't have to talk about those if you don't choose to.
That's great. Um, yeah, I guess like we can dive into our next question. I think this question is more also on like why medicine?
Mhm.
And I guess this is more so in a perspective of like how would you repeat like avoid repeating what you wrote in your personal statement?
Hmm.
Or do you think like echoing something that you wrote in your application as well is a good thing to have in fact? Or I guess just like not sounding repeating in general in the interview?
I don't know that you can totally avoid repeating what you have in a personal statement. Your personal statement was really you talking about what your pathway was to medicine, or, whatever career you're going into. Um, I, I think that most of the time when I ask a question like that, I don't ask a question of why medicine so much if I've read it in your personal statement. I'm more inclined to find out whether or not you know what you're getting into. And I know that seems a little strange, but do you know the kinds of challenges that exist there? Have you been in a situation where you've seen what physicians do? How do you feel about the electronic records that you're seeing people crying over in a hospital? It's like, I think I want to know that you're ready for this. I'm not trying to grill you on what's the best answer for why do you want to go into medicine. I want to know that you really are committed to this and you want to do this. You obviously have filled out an application and you've gone through all of that, and that's hard work. So I know you're serious about it, but have you really done your homework on being self-reflective on why do I want to do this? That's really what I'm going after. So there is the question of why medicine, but it's mostly what do you know about it and where have you been so far, and where do you want to take this? So keep it 30,000 feet. You can answer that question by just saying, in my personal statement, I talked a little bit about X. I started out doing research, and then I became really interested in translational research in medicine. And I just started moving in that direction. And basically, that is your personal statement, but that's kind of where those kinds of answers might come from. It's perfectly okay.
Yeah. I would say it's also like it's pretty much like dissecting your personal statement for the interview, which should
Sure,
be so fine. Like
sure.
I think, yeah, it's like you said, it was just like it was pretty much all you genuinely talking about yourself. So honestly, like it won't sound repetitive, or even if it sounds
Right.
somewhat repetitive, like it's probably gonna be fine too.
Exactly.
Yeah. Yeah, speaking of which, next question is that I know we talked about like how, you should find your non-close ones, presumably for the mock interviews. And this person is asking like, what are some of the effective ways to self-reflect and analyze one's own performance after a mock interview?
So I had a graduate student in my lab who was applying to medical school. I'll just tell you a little story. I don't think he'd mind that I said this story, but he ended up getting into medical school and he's in practice now. So it worked out just fine. But he came in and he said, I've never interviewed before, so I need you to interview me and just do a practice interview. And I said, oh, okay. Because I knew him, I wasn't going to be involved in the selection process of him anyway. Um, I grilled him pretty hard. I took him down some hard roads and asked him a lot of questions. And afterwards, he said, I don't know how anybody gets into medical school. And he was so shook by it. I said, now backtrack and think about what I asked you and what you feel like you need to say. This is your gift from me of the kind of questions that you're going to get. How do you really want to answer them? So find somebody, that's why I'm saying, find somebody who legitimately can ask questions of you that are likely to be asked in an interview. A faculty member is good if they have some association with admissions. That's always helpful because they are likely to be interviewing people. And so they kind of know what programs are looking for. But yeah, that would be that's how I would look at it. Find somebody who is not going to sugarcoat it and go, oh, this is the best application ever. And, I can't even imagine why a school wouldn't want you. No, that's not very helpful. It's nice. That's the mom kind of thing that I'd say to my kids, but I don't know if I would or not. Anyway, moms might say that. I will say that much, but yeah, it's not helpful to growing you.
Gotcha, gotcha. Yeah, I guess the next question is probably kind of a best, like, what is the best practice for these kind of things kind of question. This person is just wondering, like, for peers, what are the policies related to things like piercings or like colored or dyed hair,
Oh,
or what is your recommendation for that?
Because I'm a parent of two daughters who are covered with tattoos and piercings, I am perfectly comfortable with it. In a clinical setting, let me just say, in a clinical setting, sometimes people will cover up some of their major tattoos with a white coat or whatever. Um, I I think it's pretty common now. And I don't, there used to be probably people that would be very uncomfortable with that. During an interview, what I would suggest, since you don't know who's going to interview you, and it could be a more senior member of the faculty that's more conservative. You might have students that are interviewing you that are covered with tattoos. So you just cover up the tattoos. Don't make that an issue. And I would be a little bit careful with too many piercings. And I don't think there's anything wrong with that at all, but just you don't want anything to be a distractor. You want them to be listening to you and what you stand for. But as far as having those things, not a problem for the most part. It's pretty much standard operation, I think, for a lot of the young people now.
Gotcha. I guess like one last question since we're about at time as well, which perfectly wraps up all the questions that were asked today, which is perfect. I guess this person is asking a follow-up question on the why not question. I
Mhm.
guess the person is wondering like, I guess what is how would you answer it if it's not less about a gender or stereotypical, you know, condescending question being asked by the interviewer, but more so about like, why do you want to spend more time in school or much more time in school and take out loans when you can start working and making money sooner? For example, like in a career in PA, for example. And how would you answer it from that perspective?
Again, it's, it's basically, I wonder, okay, I'm going to say something here that maybe I don't want to ruffle any feathers, but I wonder how many men get asked that question. I know but the bottom line is you're applying to a program, not nursing or not medicine. Maybe it's a PA program. Maybe it is medical school. And I would simply say, I'm applying to medical school because that's what I'm really committed to do. I like being a leader of a team. I love the science, and this seems like the best fit for me. That is how I'd put that. Again, I wouldn't be too confrontational with whoever's interviewing you, just in case you can't get a third interview. I just want to make sure that that you get your point across without it becoming problematic during the interview process.
Thank you so much for that answer. Yeah, with the pretty much like time being yeah, close to three already. I just want to wrap up and I want to just thank you so much for providing such a comprehensive presentation. And honestly, I think it's super empowering your presentation is and the Q&A
Mhm.
session is like really like encouraging us to be ourselves
Yep.
and to advocate for our own rights even during the like as an interviewee, I guess, because like, at the end of the day, you're advocating for your patients and
Yes.
the like you would need to advocate for yourself when you need when it's most needed.
Right. And you also want to make sure that you find yourself in a place where you feel comfortable and where you can be
Exactly.
yourself. So, yes. And I love the questions, and thank you so much for the opportunity to have come here and spoken to you. It's wonderful.
Thank you so much for your time on the weekend to speak with us. I'm sure
Sure.
we will learn a lot. Yeah. Thank you so much.
All
And
right.
for our attendees in the room, we are super excited to say that our last session of this conference, as well as last session of today, is going to be starting sharply at 3. It's going to be a PA student panel discussion. And even if you're pre-med or pretty settled, you think you're pretty settled on pre-med, we would like to encourage you to like just take a look, like see what the PA students are talking about and seeing from their own perspective, because PA is frankly a really amazing career that I personally wish I would explore it early on, and that might have like honestly switched my career path to some extent. But yeah, with that being said, thank you so much, Dr. Mike Ozian.
Take care, everyone.